Question 1. In the context of health data management, which of the following best describes the purpose of a Master Patient Index, MPI? A. To store financial information related to patient care. B. To maintain a unique identifier for each patient across different healthcare settings. C. To track the number of procedures performed on a patient. D. To record the patient's insurance details. Correct answer: B. To maintain a unique identifier for each patient across different healthcare settings. Explanation: the Master Patient Index, MPI, is a critical component in health information management. It ensures that each patient has a unique identifier, which is essential for accurately linking all health records associated with that patient across various healthcare providers and settings. This helps in maintaining data integrity and preventing errors in patient identification. Question 2. Which of the following is a standardized terminology used for laboratory observations in health information systems? A. SNOMEDCT. B. LOINC. C. ICD-10-CM. D. CPT. Correct answer: B. LOINC. Explanation: the Logical Observation Identifiers Names and Codes, LOINC, is a standardized terminology used to identify laboratory and clinical observations. It facilitates the exchange and aggregation of clinical results for care, research, and quality purposes. SNOMEDCT is used for clinical terms, ICD-10-CM for diagnoses, and CPT for procedures. Question 3. Mr. Thompson, a 65-year-old male patient, is admitted to a hospital for a hip replacement surgery. The attending physician documents the patient's medical history, including hypertension and diabetes mellitus. The Health Information Management, HIM, department is responsible for ensuring that this information is accurately recorded and maintained. Which of the following actions should the HIM department prioritize to maintain data integrity? A. Implementing a paper-based record-keeping system. B. Regularly auditing patient records for completeness and accuracy. C. Allowing unrestricted access to patient records for all hospital staff. D. Storing patient records in a single location without backup. Correct answer: B. Regularly auditing patient records for completeness and accuracy. Explanation: regular auditing of patient records is essential to ensure data integrity. This process helps identify and correct errors or omissions, ensuring that the health information is accurate, complete, and up-to-date. Implementing a paper-based system, option A, is outdated. Unrestricted access, option C, compromises confidentiality, and lack of backup, option D, increases the risk of data loss. Question 4. In the context of health statistics and quality, which of the following is an example of a process measure? A. Patient mortality rate. B. Percentage of patients receiving recommended preventive care. C. Average length of hospital stay. D. Rate of hospital-acquired infections. Correct answer: B. Percentage of patients receiving recommended preventive care. Explanation: process measures assess the methods or procedures used in healthcare delivery. The percentage of patients receiving recommended preventive care reflects the adherence to clinical guidelines and protocols, indicating the quality of care processes. Mortality rate, average length of stay, and infection rates are outcome measures. Question 5. Which of the following is a primary responsibility of a health information management, HIM, professional in the context of coding and classification systems? A. Designing patient care protocols. B. Assigning accurate codes to diagnoses and procedures. C. Conducting clinical research studies. D. Developing hospital marketing strategies. Correct answer: B. Assigning accurate codes to diagnoses and procedures. Explanation: HIM professionals are responsible for assigning accurate codes to diagnoses and procedures using standardized classification systems like ICD-10-CM, ICD-10-PCS, CPT, and HCPCS. This ensures proper documentation, billing, and data analysis for quality improvement and reimbursement purposes. Question 6. In the context of legal, ethical, and compliance considerations, which of the following is a key principle of the Health Insurance Portability and Accountability Act, HIPAA? A. Ensuring patient privacy and confidentiality. B. Promoting the use of paper-based health records. C. Allowing unrestricted access to patient information. D. Eliminating the need for patient consent for information sharing. Correct answer: A. Ensuring patient privacy and confidentiality. Explanation: HIPAA mandates the protection of patient privacy and confidentiality by setting standards for the secure handling of health information. It requires healthcare providers to implement safeguards to protect patient data and restricts unauthorized access and disclosure. Question 7. Which of the following is a key component of a revenue cycle management system? A. Patient scheduling. B. Medical coding. C. Billing and claims processing. D. All of the above. Correct answer: D. All of the above. Explanation: revenue cycle management encompasses all administrative and clinical functions that contribute to the capture, management, and collection of patient service revenue. This includes patient scheduling, medical coding, billing, and claims processing, all of which ensure accurate and timely reimbursement. Question 8. In the context of information technology and systems, which of the following is a benefit of implementing an electronic health record (EHR) system? A. Increased risk of data breaches. B. Improved coordination of care. C. Higher operational costs. D. Reduced patient engagement. Correct answer: B. Improved coordination of care. Explanation: EHR systems enhance the coordination of care by providing healthcare providers with timely, accurate, and complete patient information. This facilitates better decision-making, reduces errors, and improves patient outcomes. While there are costs associated with EHR implementation, the benefits outweigh the challenges. Question 9. Which of the following is a characteristic of a well-designed health information governance framework? A. Lack of standardized data definitions. B. Clear policies for data access and security. C. Unrestricted sharing of patient data. D. Absence of data quality monitoring processes. Correct answer: B. Clear policies for data access and security. Explanation: a robust health information governance framework includes clear policies and procedures for data access, security, and quality monitoring. This ensures that health information is accurate, accessible, and protected, supporting compliance with regulations and enhancing patient care. Question 10. In the context of organization and management, which of the following is a primary function of a health information management (HIM) department? A. Direct patient care. B. Management of health information systems. C. Conducting clinical research. D. Developing marketing strategies. Correct answer: B. Management of health information systems. Explanation: the HIM department is responsible for managing health information systems, ensuring the accuracy, confidentiality, and accessibility of patient data. Question 11. Which of the following best explains why a hospital would use a data dictionary within its electronic health record (EHR) system? A. To eliminate the need for training staff on data entry. B. To define and standardize data elements across systems. C. To control network traffic between clinical departments. D. To automatically detect coding errors in reimbursement. Correct answer. B. To define and standardize data elements across systems. Explanation. A data dictionary ensures consistency by defining each data element, its format, acceptable values, and meaning. This facilitates data integrity, interoperability, and reliable reporting across systems. It is foundational to maintaining standardized, structured data within EHRs. Question 12. Which of the following statements best reflects the intent of root cause analysis, RCA, in healthcare quality improvement? A. To assign blame for a medical error. B. To track coding compliance. C. To identify underlying causes of adverse events. D. To evaluate reimbursement trends. Correct answer. C. To identify underlying causes of adverse events. Explanation. RCA focuses on identifying systemic issues that lead to adverse events, rather than individual blame. It is a structured method promoted by organizations like the Joint Commission and AHRQ for improving patient safety and care quality. Question 13. Ms. Rosario, a health information manager, is tasked with reducing documentation discrepancies in inpatient records. She notices frequent inconsistencies between physician notes and nursing documentation. Which of the following is the most effective first step she should take? A. Initiate disciplinary action for staff providing inconsistent entries. B. Develop a comprehensive training on documentation standards. C. Restrict documentation privileges for new staff members. D. Assign all documentation responsibilities to the physicians only. Correct answer. B. Develop a comprehensive training on documentation standards. Explanation. Discrepancies often arise due to unclear documentation expectations. Providing comprehensive training ensures that all providers understand documentation requirements, promoting accuracy and consistency. This aligns with CMS and Joint Commission documentation guidelines. Question 14. Which of the following best describes the Six Sigma approach in healthcare quality improvement? A. A method for selecting project managers in HIM. B. A patient feedback system for service delivery. C. A data-driven methodology to reduce process variation and errors. D. A CMS auditing model for evaluating inpatient procedures. Correct answer. C. A data-driven methodology to reduce process variation and errors. Explanation. Six Sigma focuses on reducing variability and defects in processes. In healthcare, it's used to enhance efficiency and patient safety by applying statistical tools to identify root causes of process issues. It complements other models like PDCA. Question 15. In a healthcare facility using a matrix organizational structure, which of the following is most likely to occur? A. Each employee reports to a single supervisor for all tasks. B. Clinical decisions are made solely by financial managers. C. Employees report to both functional and project managers. D. Patient care is dictated by marketing trends. Correct answer. C. Employees report to both functional and project managers. Explanation. A matrix structure blends functional and project management. Employees may report to more than one leader, supporting collaboration across departments. This model is used in complex healthcare settings to enhance coordination. Question 16. Which of the following is a key difference between ICD-10-CM and CPT code sets? A. CPT is used for diagnosis coding, while ICD-10-CM is used for procedures. B. ICD-10-CM is used only by private insurers, while CPT is used by Medicare. C. ICD-10-CM is used for diagnosis coding. CPT is used for outpatient procedures. D. CPT and ICD-10-CM are used interchangeably in all settings. Correct answer. C. ICD-10-CM is used for diagnosis coding. CPT is used for outpatient procedures. Explanation. ICD-10-CM is used for coding diagnoses across all healthcare settings, while CPT codes are used to report outpatient and professional procedures. These are essential for reimbursement and compliance with CMS and payer rules. Question 17. Which of the following would most likely lead to a mismatch in the Master Patient Index, MPI? A. Consistent use of a unique medical record number. B. Reuse of identifiers for new patients. C. Mandatory demographic field validation. D. Integration of facial recognition for identity matching. Correct answer. B. Reuse of identifiers for new patients. Explanation. Reusing patient identifiers compromises MPI integrity, resulting in duplicate or overlaid records. Ensuring unique identifiers and standardized demographic data entry helps prevent such critical patient safety and data quality issues. Question 18. Which of the following best represents an example of a value-based purchasing model in healthcare reimbursement? A. Hospitals are paid based solely on number of procedures. B. Payment is made before any services are rendered. C. Reimbursement is linked to patient outcomes and quality metrics. D. Providers set their own fee schedules without payer oversight. Correct answer. C. Reimbursement is linked to patient outcomes and quality metrics. Explanation. Value-based purchasing aligns reimbursement with quality rather than quantity. CMS rewards hospitals for improving care quality, patient satisfaction, and reducing costs, encouraging efficient and effective healthcare delivery. Question 19. Which of the following data standards is most associated with interoperability of clinical data exchange between systems? A. DRG. B. HL7. CEM. D. CPT. Correct answer. B. HL7. Explanation. Health Level 7, HL7, standards enable the electronic exchange of clinical data between disparate healthcare systems. They support interoperability, allowing EHRs and ancillary systems to communicate seamlessly, essential for care coordination. Question 20. In the HIM role, what is the best response when discovering a physician's documentation is consistently vague and lacks clinical specificity? A. Ignore the issue, as physicians are responsible for their own notes. B. Submit documentation for coding without follow-up. C. Initiate a compliant clinical documentation improvement, CDI, query. D. Delete incomplete notes and request redocumentation. Correct answer. C. Initiate a compliant clinical documentation improvement, CDI, query. Explanation. CDI programs promote documentation clarity and accuracy. When notes lack specificity, a compliant query helps physicians clarify without leading or suggesting diagnoses. This supports better coding, compliance, and care quality. Question 21. Which component of the revenue cycle management process directly affects accounts receivable and cash flow? A. Advanced directives. B. Charge capture. C. Medical research funding. D. Risk adjustment factor scoring. Correct answer. B. Charge capture. Explanation. Charge capture ensures services provided are accurately documented and billed. Errors or omissions in this step can delay claims, reduce reimbursement, and negatively impact the healthcare facility's financial health. Question 22. Which of the following is most important for maintaining the legal integrity of an electronic health record, EHR? A. Frequent deletion of old notes. B. Allowing unrestricted edits by users. C. Tracking changes through audit trails. D. Accepting verbal updates without notation. Correct answer: C. Tracking changes through audit trails. Explanation: audit trails are essential for legal integrity, showing who accessed or modified records and when. This supports accountability, meets HIPAA security standards, and protects the organization in legal proceedings. Question 23. Dr. Barrett frequently modifies documentation in the EHR after claims have been submitted. This behavior is detected during an internal audit. What is the most appropriate action for the HIM compliance officer to take? A. Allow changes to continue, as physicians own their records. B. Report the behavior to federal authorities immediately. C. Conduct a formal review and initiate training on compliant documentation. D. Deactivate Dr. Barrett's EHR access permanently. Correct answer: C. Conduct a formal review and initiate training on compliant documentation. Explanation: altering documentation post-submission can lead to compliance issues. A structured review and education on post-payment documentation rules per CMS and OIG guidance is essential to prevent fraud and maintain ethical standards. Question 24. In health data abstraction, which of the following best describes qualitative data? A. Blood pressure measurements. B. Length of hospital stay. C. Patient satisfaction comments. D. Hospital admission counts. Correct answer: C. Patient satisfaction comments. Explanation: qualitative data includes non-numeric information such as opinions, experiences, or perceptions, commonly gathered through surveys or interviews. In contrast, other choices represent quantitative data used in statistical analysis. Question 25. Which statistical concept refers to the likelihood that a result is not due to chance alone? A. Mode. B. Variance. C. Statistical significance. D. Interquartile range. Correct answer: C. Statistical significance. Explanation: statistical significance indicates that a result is likely not due to random variation. It's commonly evaluated using a p-value threshold, typically 0.05, guiding decision-making in healthcare research and performance analysis. Question 26. In a HIM department, which of the following strategies would best support effective change management during the rollout of a new EHR system? A. Avoiding communication until after go-live. B. Requiring staff to self-learn the new system. C. Engaging stakeholders early and providing training. D. Minimizing leadership involvement. Correct answer: C. Engaging stakeholders early and providing training. Explanation: successful change management involves stakeholder engagement, clear communication, and comprehensive training. These elements reduce resistance and promote user adoption, aligning with IT governance best practices and HIM leadership principles. Question 27. Which of the following is most critical to the success of a clinical documentation improvement (CDI) program? A. Relying solely on automated queries. B. Engagement and collaboration with physicians. C. Reducing the number of documented diagnoses. D. Limiting CDI efforts to outpatient settings. Correct answer: B. Engagement and collaboration with physicians. Explanation: a successful CDI program depends on physician buy-in. Continuous collaboration ensures timely, accurate, and specific documentation, which supports coding, quality reporting, and reimbursement accuracy. Question 28. Which of the following actions aligns with ethical HIM practice when faced with a known privacy breach? A. Suppressing the incident to avoid legal repercussions. B. Waiting for a patient complaint before investigating. C. Initiating breach risk assessment and notification. D. Deleting affected records. Correct answer: C. Initiating breach risk assessment and notification. Explanation: under HIPAA's breach notification rule, covered entities must assess the risk and notify affected individuals, HHS, and in some cases the media. Ethical HIM practice involves transparency and compliance with legal standards. Question 29. Which measure is used to assess central tendency and is most appropriate for skewed data distributions, such as hospital charges? A. Mean. B. Mode. C. Median. D. Standard deviation. Correct answer: C. Median. Explanation: the median represents the middle value and is less affected by extreme outliers, making it ideal for skewed data like hospital charges. The mean is more sensitive to high or low values. Question 30. Which of the following best illustrates the principle of role-based access control, RBAC, in data security? A. Allowing every user to view all patient data. B. Restricting access based on the user's job responsibilities. C. Encrypting all files with a single password. D. Printing records for manual distribution. Correct answer: B. Restricting access based on the user's job responsibilities. Explanation: RBAC ensures users can only access data necessary for their roles. It is a HIPAA-compliant security measure that protects sensitive information and supports audit readiness.